Once you've gone through the testing, your donor has been cleared, you as the recipient, you've also been cleared, then we set up a date for the kidney transplant. And that would cost somewhere about 1.5 million, at least for us here in Eldoret, about 1.5 million shillings is what you will need for your kidney transplant. And that's a standard kidney transplant. Sometimes, of course, things can happen. Maybe other doctors might be involved in your care, or maybe extra medication might be needed, or maybe you need to be kept in the hospital for a little more. Then that might cost a little extra beyond that 1.5 million. Today we would like to talk about a frequently asked question about kidney transplants. So many people ask us, Doc, I have a relative, or Doc, I am a patient and we need a kidney transplant. My relative needs a kidney transplant, or I myself need a kidney transplant. Doc, what are the cost implications? How much do I need? That's a very good question. And probably things might change between what we are doing now or what we know now and maybe what will happen in the next 6 to 12 months. But in general, I try and tell my patients that the money needed to prepare for a kidney transplant and to get the kidney transplant operation is probably not the most important money. The most important money is the money that you need after the kidney transplant. The money that you need on a day-to-day basis for your medications might be the more important bit. And actually from our data and from what we are seeing among the patients that we're taking care of so far, most of the struggle is with the money needed for the day-to-day medications, especially after year 1, year 2, going forward, when you're feeling at your best. But coming back, in general, you will need probably somewhere between 300 and 400,000 to prepare. There are tests that are needed for preparation. There are tests that are needed to check and make sure that the donor is fit to donate and is fit to go through theater. And then there are tests that are also done on the recipient, that's the patient who needs the kidney, to make sure that they are also fit, that they do not have any dangerous things that might put them in danger to undergo a transplant. We also make sure that they can go through theater safely, and we check them. So that checking bit and the preparation bit costs somewhere between 300 and 400,000. Plus or minus, it might be slightly more or slightly less depending on the circumstances. For example, people who have diabetes, we tend to do a lot more tests, especially looking at their hearts, and therefore the cost is on the higher side, about 400 or maybe even more. And then the younger people, the people who do not have a lot of problems, maybe a young 20, 30-year-old who has kidney failure out of nowhere, those people tend to probably need less testing, and probably they might be on the side of 300,000 or maybe slightly less. Now, what about the kidney transplant itself? Once you've gone through the testing, your donor has been cleared, you as the recipient, you've also been cleared, then we set up a date for the kidney transplant. And that would cost somewhere about 1.5 million, at least for us here in Eldoret, about 1.5 million shillings is what you will need for your kidney transplant. And that's a standard kidney transplant. Sometimes, of course, things can happen. Maybe other doctors might be involved in your care, or maybe extra medication might be needed, or maybe you need to be kept in the hospital for a little more. Then that might cost a little extra beyond that 1.5 million. So in general, it costs about 1.5 million for the operation itself. And then after the operation, usually the donor would stay in hospital for about 3-4 days, maybe at most 5 days. And then the recipient will stay in hospital for about 7 days, give or take. The younger patients might stay 6 days. The older patient might stay maybe 8 or 9 days, but in general, about 7 days. And then if everything goes well, you go home, and then after that, you come to clinic. For us, we see our transplant patients 2 times in a week for the first 1 month, and then once a week for the second month, and then once every 2 weeks for the third month. And because of that, they'll be coming in for that first week, and they'll be doing tests for every visit. There'll be an extra test that they do once a week, but then for every visit they do a standard menu of tests, and that comes with a cost. And then of course they'll need their medications, the anti-rejection medications, the medications that keep this new kidney protected from rejection. And those medications can cost somewhere between 30,000 to around 50,000, plus or minus. Sometimes it might be a bit more for some patients, and sometimes it might be slightly less for some patients. But in general, about 30 to 40,000. And then, of course, you'll also need money for the blood tests and for the visits. And the first 1 month is really intense, because if anything is to go wrong, it usually goes wrong in that first month. And that's why we have that frequent visits and frequent blood tests, to just make sure everything is going okay. And then from there, things start getting easier. The visits become fewer, and the medications also become less as time goes. But in general, the cost will be somewhere between 30 to 50,000 shillings a month. Now, we are very lucky here in Kenya that we have we've been using NHIF. NHIF has been paying for some of the costs, especially when you get admitted and you undergo the kidney transplant. NHIF generally will pay about 500,000 for the donor and the recipient, and that usually helps a lot, and cuts down some of the cost. Up to now, NHIF has not been paying for the medications after the transplant. So usually, unless you have maybe an insurance cover, or maybe you have a special NHIF comprehensive cover, then you get the medications from that package. But many people have had to buy the medications. But as we all know, there's a new NHIF coming in called the SHI, or Social Health Insurance, which is coming in to replace NHIF. And this is an exciting prospect for us, because it's an updated version of NHIF, and more importantly, it will take care of the kidney transplant process, both before the operation itself and the after, which is really the important bit that I normally talk about. They will actually be taking care of the care after the kidney transplant. They'll take care of the medications and the blood test, and that's a big deal. I think that would really revolutionize how we take care of our kidney patients. So let's watch out for that. I think it's an exciting prospect, and the future for our kidney patients is really bright. So if you're thinking about doing a kidney transplant, this is the time to do the kidney transplant, because when SHI comes, your care will be taken care of. And I think that's a really beautiful thing for our country. So anyway, thank you very much for joining us. It's been a pleasure to have you in our channel today. We still request that you subscribe to our channel, click on the notification icon, and stay tuned for more interesting and exciting content from our channel. Thank you very much.